Hey YouTube! Today I'm posting another update to my personal vlog on my laser eye surgery healing progress. So the last video I posted was on day 23 post-surgery, and today is basically day 58 post-surgery. And so from day 23, I sort of shared some of the challenges that I had and some of the scares that I had to go through because I was going gangbusters using prednisolone every 2 hours, and then of course that caused elevated optic eye pressures, which then needed me to take glaucoma medication, and sort of had a little medical scare there where they thought that the elevated pressures could have damaged my optic nerve. And of course, since then, all the way up until about day 51, I was told to roll back on my steroid usage to just twice a day, and to use this product called Cosopt. It's another single-use minim here, 2 times a day, and that's basically the eye drop equivalent to keeping your eye pressures at bay. And so that was fine and dandy, and of course since day 23, I feel that my vision and the dryness in my eyes has improved, not dramatically, but enough such that I'm not sitting this far away from my computer screen anymore. I can use an iPad, I can use a computer, I can even watch television, with some degree of clarity at least. It's not clear, and by the end of a workday, I am absolutely fried. I'm almost spent in every possible way, and I can't even play with my kids sometimes because I've just got this wicked migraine from just staring at my screen. But that's really besides the point. At least I can work, at least I can earn income, at least I can go about life somewhat like a normal person. What was really discouraging was the fact that when I went to my last appointment, I think it was at day 55 or day 54, so basically almost at the 2-month mark. And since they changed my medication routine, that my eyes, according to them, still looks like a pitted windshield and has barely done any healing since day 23. And so they measured my vision. My left eye is at 20/30, which isn't that bad, and my right eye is at 20/40, which probably isn't a surprise because it's a week behind the left eye. But that's certainly not 2020 or even the 2015 that they were trying to gun for. And so I was told that from their clinic's perspective that my eyes, or me, fall into less than 1% of their customer base that have experienced as many problems and nuisances that I have. And if this continues on, I'm going to fall into less than 0.5%. So I'm literally becoming a statistic in a bad way. However, I'm not going to be blind, thank goodness. It's just that my vision may never ever be perfect. We'll have to see. But anyway, so my last appointment, they basically said, this is weird. You know, there's a fusion line called an SPK line, and they said that it's still very much there, and it's all pitted and not really healed over. And so they suspect at this point that my body is now either developing a toxicity or a resistance to the medication eye drops. And so I'm now being told to take a 1-week medication vacation and see what my body does on its own. Of course, with anything, there's certainly risk to it, and basically what could happen is that my cornea could start to haze over, and of course that would lead to cloudy vision, which then they would have to go and treat with huge amounts of steroids, which is not ideal. But I guess I'm at a point now where I don't really have anything to lose, because if I continue on with using what I'm using, twice a day drops, I'm not making any progress. If I take a medication vacation, I could potentially reap the benefits of my body doing its own thing the proper way and allowing it to heal. And then if that doesn't work, then we're going to have to start looking at other options, such as using contact lenses with some degree of corrective sort of powers to them. And the other benefit is that it covers this fusion line, which is supposedly allowing it to heal. But of course, the main problem with that is anytime you start introducing things into my eyes, it seems like irritation and inflammation always seem to surface very quickly, which then stops the healing, and then, well, I'm pretty much at a stalemate constantly. So that kind of sucks. However, I'm going to remain optimistic and hope that these guys know what they're doing. I mean, they did actually help pioneer laser eye surgery in Canada, so it's not like they're not experts in what they do. It's just my body's a pain in the ass. So there you guys have it. Again, my sort of comments from my previous video is that, you know, my view on laser eye surgery at this point is sort of very much reserved. You know, if you're absolutely adamant on doing it, great, go and do it. but just understand some of the risks that come with it. I'm a prime example of a laser eye surgery that has gone wrong, not because of the doctor, but just because of the way my body reacts. Not great, and certainly this experience has been a total turnoff for me. And I mean, they actually mentioned to me last week that goes, oh well, maybe we can repeat your eye procedure later on down the road, but how we're going to treat it and how we're going to go about doing it now is going to be very different than what we did the first time. Meaning they're going to do one eye, let it heal completely, and then do the other eye. But to be honest with you, after telling everyone here what I've gone through, do you think that I'm going to be interested in doing that at this point? At this point, no. I would rather go back to wearing a very low-powered pair of glasses than to go through all of this. I'm just grateful I can go back to work. I'm grateful that I can function, right? So if I had to go through what I did at the beginning of January, yeah, probably not. Anyways, I'll keep you guys posted. Subscribe to my channel to get the latest updates on this particular vlog and any other DIY videos that you guys like watching on my channel. Talk to you soon.